Hello, my dear friends. This is Dr. Charles from PHI Preventive Health Institute, where we share practical lessons drawn from real cases we see every day. Behind every symptom is a real story, and today's topic is inspired by one we recently encountered, one that is more common than many people realize. That's why our team is breaking it down from 4 key perspectives: what the doctor sees, what the nurse manages, what the pharmacist safeguards, and how the dietitian supports recovery. Each piece stands on its own, but together they reveal the bigger picture. Be sure to explore the rest of the series. Now, let's look at this from the pharmacist perspective. In real life, headaches linked with blood pressure really start as a medical concern. They start as inconvenience. A mild headache appears. It is managed quickly with a painkiller. The discomfort settles, and normal activity continues. Nothing feels unusual at first. But when this pattern repeats over time, something changes in the background. Because repeated symptom relief without review gradually turns into repeated self-medication. And that is where risk begins to build. The key issue is not the occasional painkiller. It is the system of repeated unmonitored use, especially in people who may also be living with high blood pressure. Because in this system, 3 things start interacting: pain control, blood pressure regulation, and kidney function, and they do not operate independently. Now look at what is often missed. Some commonly used painkillers, especially anti-inflammatory types, can raise blood pressure over time, reduce the effectiveness of blood pressure medications, cause fluid retention, and increase strain on the kidneys. Individually, these effects may seem small, but when repeated use is added into the system, the balance begins to shift. Blood pressure becomes harder to control. Headaches become more frequent. Medication response becomes less predictable. So the first step is not stopping medication. It is identifying what is being used and how often. Because a painkiller is not a single safe category. Different medicines behave differently in the body. Some are relatively safe in hypertension. Others can quietly worsen control when used frequently. Without that awareness, treatment becomes guesswork. Then comes safe use. Painkillers should be used only when necessary, taken at the correct dose, avoided in repeated cycles without review. Check for safety in people with hypertension or kidney risk, because the goal is not pain suppression at all costs. It is safe symptom control without disrupting the system. Now step deeper into the pattern seen in practice. A patient begins using painkillers frequently. Blood pressure becomes less stable. Headaches return more often. Stronger or more frequent tablets are used, and the assumption becomes the condition is getting worse. But in many cases, the medication pattern is part of the problem, because pain relief is masking the signal while the underlying system is shifting. This is why consistency in blood pressure medication matters. Blood pressure treatment is not symptom-based, it is maintenance-based. Irregular use, even of the correct drug, can destabilize control. And when combined with frequent painkiller use, the system becomes harder to stabilize. Now step back and look at the system. Painkillers affect kidney function. Kidneys affect fluid balance. Fluid balance affects blood pressure. Blood pressure affects symptoms. Symptoms influence more medication use. A cycle forms, and if not checked, it continues quietly. So when medicines are used correctly, the outcome is not just pain relief. It is system protection, stable blood pressure, safer kidney function, and reduced medication complications. Lower risk of long-term cardiovascular disease. Final point, not all headaches are simple. When they repeat, they are often part of a larger pattern, and relief alone is not control. Because if the system is not reviewed, the cycle continues underneath. So do not only treat the pain, understand what is driving it. If you experience frequent headaches, are on blood pressure medication, or regularly use painkillers, do not ignore it. Speak to your pharmacist or healthcare provider for proper review, or call or WhatsApp us at +233 208 720 347. And remember to watch the other 3 videos from the dietitian, nurses, and doctor. Each perspective completes the picture.